when we come in for our annual, do you guys brush their teeth?
What do you say annual? Annual dental cleaning?
My annual dental cleaning. I'm coming in for my annual dental, right? I'm doing my whole thing. I'm doing my thing on my cat. I'm going to pay for it. I come in. When you guys are doing that, do you guys just do x-rays and point out what's wrong, or do you brush their teeth?
So, a dental cleaning is under anesthesia. All right?
Okay.
It's under anesthesia. There's no way, I agree with you, the cat's going to let you, just like we get our dental cleaning with our hygienists, they scale, they take dental rads, right? We have to bite down on that little piece, and then we have to hold still, and then they take our picture. Cat's not going to be compliant like that.
Hey, without going really crazy on it, but I think it might be interesting because this sparks a whole different conversation. When I'm doing a dental, what should I be expecting, right? Because I wasn't even thinking about the fact that they're under anesthesia.
Yeah.
So real quick, what does that look like? I go in, I have to get my blood work done because why am I doing the blood work?
Yeah,
because it's under anesthesia.
It's under anesthesia. We want to make sure those organ systems are up to par before I put your cat at any anesthetic risk.
It's like, voila, suddenly it makes sense, right?
Yeah.
Why do you got to give my cat blood work because you're working in its teeth? And it's like...
and don't forget, we're guaranteed some disease is in that mouth. So what has your cat been dealing with for said time before I got this dental?
So you go in, we do the blood work, make sure that the cat's going to be cool with...
Certified anesthesia.
But be cool with going under anesthesia, right?
For sure. And the medications I'm going to put on board. Right, so we're going to place a catheter. We're going to put them under some pre-medications to make sure they're comfortable. We're going to put them under a gas anesthetic when it's ready. And then we're going to scale. We're going to take dental x-rays of those teeth. We're going to polish those teeth when they're ready. And that's when the doctor comes in to make sure all the teeth are aligned. And whatever defects that my licensed veterinary technician found, I will confirm or deny if these are good to go, or we can stay, or we can just do some form of treatment on them. If they're infected, right? And then we have to pull them. This is oral surgery, right? On the ones that have to go. We talked about levels. If you have 50% bone loss, tooth exposure, fractured teeth, roots that are broken and hidden underneath the gum line, that's when we call you as a doctor, say, hey, we found some things. And that's what we beg you guys, please make sure you're around that phone because your cat's under anesthesia during this time. I need you to answer that phone because I can't keep them under anesthesia while we wait on you to answer.
Right.
So
now I've already heard that, so we did blood work, so somebody had to pull blood.
Yeah.
Then we had a tech or an assistant working with us, and we have a doctor working on the case.
Correct.
So I'm already hearing 3 people. Mm-hmm. I'm hearing things have to go to lab because that's where that blood work is tested, mm-hmm. right? So I'm hearing that. Then we're going under anesthesia, and I'm sure that while the animal is under anesthesia, we have to have somebody supervising the animal at all times, right?
All day. Absolutely. I mean, we have monitoring systems too. So EKG, heart rate monitoring.
So now we're talking about big dollar equipment.
Well, this is just routine procedures for any anesthetic risk procedure we're going to do.
But,
this is very common.
But Doc, I'm talking about for me, right? People like me.
Uh-huh.
Don't know how many people are like me. We don't realize that. Like you guys say this easily, like this is just a standard, this is how it should be. Which I'd probably give you some pushback and tell you that not everybody's doing it that way, right? Not everybody's doing blood work before they're doing their dentals. I'm sure some people are cutting some corners.
Cutting some corners, but you just don't know what you don't know.
Yeah.
And we don't want anything to happen. I want to make sure, me particularly, I like to make sure that I'm in line with the client and that I have the best interest for the pet. I don't know what I don't know, and I know you don't either. And again, we're talking about a patient, your cat, that is the biggest liar in general, like pit bulls, that won't tell you. And they will fake it till they can't make it. And I promise you, when something goes wrong, and I don't know what I don't know, and you don't know what you don't know, cat goes downhill, you're going to be mad at me. And the only thing you're going to think of is we just saw Dr. Owens, or my vet, such time ago, and he didn't say anything about this. And we forgot that we declined X, Y, and Z. Now, the way I run my practice, I don't allow that. If I can't get blood work or preliminary care, I don't do it. I won't, because I don't want to set up your cat or your baby for any kind of risk that I just don't know about, and it's unnecessary.